Hi everyone, I see lots of waves, so I'm going to go ahead and get started because it's 4 o'clock. So again, my name is Dr. Erika Moody and I'm with Pelvic Rehabilitation Medicine in Houston, and I'm a physiatrist. And I'm here today to discuss personal lubricants, and we're going to keep this very scientific and evidence-based. So after we finish today, I'm going to link the references for your review to the video. So I encourage you to look into those. They're publicly accessible journal articles, as well as the World Health Organization guidelines from 2012. So these are all publicly accessible. So first I'm going to start off by what are the types of lubricants, because I feel like that's just the basic starting point. So there's basically 4 or 5 types of lubricants. The most commonly found is what we call a water-based lubricant. So these are most widely readily available, but they also contain preservatives that are used to prevent microbial growth. So these preservatives, which we're going to get into a little bit more later, can have some potential negative consequences to them. The second type is a silicone-based lubricant. So these are hypoallergenic. They tend not to cause irritation, but they're less readily available and have a higher cost to them typically. The third type is what, I'm seeing questions. I will address the questions towards the end. The third type is a hybrid lubricant. This is a mix of water, a water-based lubricant, and a silicone-based lubricant. Again, these tend not to cause irritation, but they're less commonly found and tend to have a higher price point. The fourth base is called a plant oil-based lubricant. These tend to be moisturizing or often all natural. They're often organic, but they're also not safe for most safe sex barrier methods made of latex or polyisoprene. And they can also flare certain conditions like bacterial vaginosis or vaginal yeast overgrowth if you're someone who's already prone to those. The fifth type is glycerol based. So these are found in warming lubricants that are on the market. So when the first ingredient that's listed is glycerol or propylene glycol, that's the primary component of those. And we'll get more into why that chemical can be a chemical of concern in many people. So now we've kind of touched on the basics of like what are the different types. So what are the potential problems with lubricants? So while lubricants can be very effective at reducing discomfort at the time that they're used, researchers are becoming increasingly concerned about the potential longer-term health effects of exposure to these products. So unfortunately, many times not enough care has been taken to design lubricants that are truly safe and healthy for vaginal and rectal tissues. So you can develop skin, I already saw a question about infections. So absolutely, you can develop infections by throwing off your pH and changing that healthy bacterial flora that is already found in our vaginal or rectal tissues. And the secondary structures such as our urethra and travel up to the bladder and absolutely create, a urinary tract infection. That's possible. So the three types of conditions I'm going to discuss today are contact dermatitis is number one. So this is basically, think like an itchy, red, swollen rash that can last anywhere from days to weeks at a time. This is pretty common, and it's caused typically by hyperosmotic lubricants. So I'm going to discuss a little bit more later in the talk about what that exactly means, but briefly it means that the lubricant is pulling water out of the tissue and dehydrating the cells, which is creating irritation and potentially damaging the mucosa. Other common offenders for contact dermatitis include some toxic chemicals that are irritants and preservatives. So things like propylene glycol, polyquaternum 15, potassium sorbate, or glycerin. These can lead to contact dermatitis. The second condition is vaginal yeast overgrowth, which I briefly mentioned before. This is also called candidiasis or thrush. Typically we use the word thrush if it's involving the oral mucosa. So this happens when the pH or the flora in the vagina becomes imbalanced and an overgrowth of yeast occurs. So it's important to know that yeast is found on our body naturally, and in our vaginal mucosa, yeast is already residing there. But it becomes a problem and becomes an infection when we give something that is causing that yeast to grow, either orally or placing that on our skin. So things that contain sugar or sugar byproducts are going to increase and feed that yeast that's already there. So this includes things like sucrose, honey, glycerin, glycerol, and maltodextrin. So that's going to feed the candida or the yeast cells that are already there and can lead to overgrowth of those cells. This secondarily can have a negative consequence by causing irritation of those tissues when you have that yeast overgrowth, and can leave the mucous membranes of the vulva and the vagina more susceptible to injury and secondary effects of even increasing risks of sexually transmitted diseases. The third condition is called bacterial vaginosis, which I mentioned before. This is also known as BV. So this occurs when you have vaginal irritation or inflammation, which is caused by an imbalance of naturally occurring bacterial flora. Primarily, this is an imbalance in the lactobacilli. So something has occurred where that natural ecosystem has gotten out of balance. So these are healthy bacteria that are found in the vaginal flora. And when they're imbalanced by exposure to certain chemicals or irritants, then it becomes a problem that needs secondary treatment. So it has been linked, BV or bacterial vaginosis has been linked to vaginal exposure to petrochemicals. So these are chemicals that are made out of crude oil and other products. So it can be found in soaps or detergents, and also lubricants that contain harsh microbicides that are going to kill off basically any healthy bacteria that's residing there. So these are chemicals like chlorhexidine gluconate and sodium hydroxide. So it's going to kill off the lactobacilli and contribute to a secondary infection. So now I'm going to move to like you're looking into a lubricant and you want to be able to assess it other than those chemicals that I've already mentioned, and we kind of know what the skin conditions and the secondary infections and things that can occur. So how do you go about assessing a personal lubricant? So I'm going to break that down into three things. So those three things are pH. So what is the pH of the lubricant and what is the number that you're looking for? What is the osmolality? So I briefly mentioned osmolality before. I'm going to go a little bit deeper into that. And then review more of those toxic chemicals. So I already mentioned several of them, but there's more on the list. So pH. So pH, kind of, let's go back to our middle school science days of what is pH. It means, how acidic or basic a chemical is or a substance is. So neutral is 7. Anything above 7 is going to be more basic, and anything less than 7 is going to be more acidic. So what is the pH that we're looking for? So the pH of our healthy vaginal flora is in a range from 3.8 to 4.5. So ideally, a lubricant should match the pH of our vaginal tissues. If you're looking for a lubricant that's, for rectal use, it's going to be a pH closer to 7, which is more neutral. So what happens if you have a higher pH vaginally? It's associated with increased risks of those infections that I mentioned before, like bacterial vaginosis and yeast infections. And unfortunately, many commercially available lubricants have pH levels that far exceed that 4.5 number that is healthy, normal vaginal pH. So the second thing you want to consider is osmolality. So I mentioned this before. We don't want to put a hyperosmolar product on our skin and dehydrate the tissue and cause irritation and secondary effects. So let's start by defining what osmolality means. It basically is a measure of dissolved particles per unit of water in a solution. It's measured in milliosmoles or milliosmoles per kilogram. It refers to a substance's ability to draw moisture out of tissue and cells. So exposure to a lubricant with a higher osmolality than normal vaginal secretions can result in vaginal tissue becoming dehydrated because the moisture of those cells is being pulled out. This leads to irritation and breakdown of the mucous membrane barrier that's normally there to protect the vagina and the rectum from infection. So disruption of mucous membranes leads to increased risk of sexually transmitted diseases, in addition to creating irritation and discomfort. So if a lubricant has a higher osmolality than the cells of the body, we call it hyperosmotic. So I mentioned that before. Hyperosmotic is what we're trying to avoid. And unfortunately, many commercially available lubricants are hyperosmolar, which means that they're detrimental to your tissues. So an ideal lubricant would be what we call isoosmotic, meaning that it has the same hydration level as the cells of our body. And the cells of our body have a hydration level or an osmolality of 285 to 295. So that's kind of a hard range to remember, so I kind of just round up to 300. Think 300 cells of your body, that's the number you're looking for, ideally. So the third thing I kind of mentioned before, briefly, I'm going to dive deeper into toxic chemicals. So I mentioned several of those, but I'm going to repeat some of those and add a few more. So toxic chemicals. So these can lead to discomfort, irritation, and increased risk of infections, even with short exposures, and have the potential to cause longer-term health effects, including cancer and reproductive problems with repeat exposure over time. So I mentioned chlorhexidine gluconate. So we use this like in the operating room. It kills everything, essentially. It kills off the good bacteria, it kills off fungi, it kills all microorganisms. So it's going to throw off the pH potentially and create secondary problems. One I didn't mention before is parabens. So parabens usually have a word before the word paraben is how you're going to read the ingredient list. It includes methylparabens and polyparabens, and these are preservatives that are commonly found in lubricants. The concern is that parabens may be endocrine disruptors and act in an estrogen-like fashion and mess with people's hormones, essentially. They can increase the risk of certain types of cancers and even create fertility problems. So avoiding parabens is really important. I mentioned before propylene glycol. So propylene glycol is the active ingredient in many of those warming lubricants I mentioned before, as well as it's the active ingredient in antifreeze in your car. So the fact that this is found in a product that we're applying to our skin and sensitive areas of our body is really not good. It's used as a preservative and also as a humectant, meaning that it helps to retain moisture, but it's going to create secondary problems in a lot of instances. The fourth compounds are what I call the cyclo compounds, meaning that they have the word cyclo or CYCLO prior to some longer chemical term. This includes cyclomethicone, cyclopentoxyloxane, cyclotetrasiloxane, really difficult to pronounce words with cyclo before them. These are commonly found in silicone-based lubricants and are linked to reproductive harm and uterine cancer in animal studies. I don't think, to my knowledge, we have human studies available, but I think it's concerning that we have animal studies that link this to potential detrimental outcomes. Glycerin. So I mentioned glycerin before. That's kind of similar to the propylene glycol. So it's a metabolic byproduct of sugar. It's used as a humectant, a preservative. It's commonly found in flavored and warming lubricants, and it can serve as a food source for microbes. So it can contribute to yeast overgrowth and secondary infections, particularly if you're someone who's already prone to them. Undisclosed flavors and fragrances. So this can include, these are potential carcinogens, and they can be reproductive toxins or allergens, so they may not disclose that a lubricant has certain chemicals in it because they're not required to disclose that information. So it's important to be mindful of that, really avoiding things with fragrance or flavors in them. This is a long word, nanoxanol 9. Nanoxanol 9 is an active ingredient in spermicide. So I think this is one to use with caution. So, spermicides are important to prevent pregnancy and conception, right? I think they have a role, but if you're someone who is prone to, say, bacterial vaginosis, it can throw off the healthy microbiome that's already there and can lead to secondary infections. So many condoms come prepared with this ingredient as a spermicide, so it's just important to be mindful of that. I mentioned before petrochemicals. These are petroleum-based or crude oil-based compounds. These are going to alter the pH of tissues, which can lead to higher chances of infection. And then lastly, I mentioned before polyquaternium 15. So this is a really harmful chemical. It's been shown to increase the risk of the transmission of HIV. So it's actually mentioned throughout the World Health Organization guidelines as a chemical to avoid, and it has been found in some of the commercially marketed lubricants out there. So let's just summarize, how to find a safe lubricant is the question. So you want to review the pH, you want to review the osmolality, and you want to review the ingredients carefully prior to use. You want to review the list of the lubricants testing results that are publicly available through your search engine. Search World Health Organization lubricants and it's going to come right up. And they have a great chart there that lists the pH, the osmolality, as well as information on chemicals of concern. The World Health Organization has specific recommendations regarding lubricants. So they recommend using a lubricant with a pH less than 4.5. Again, that's specifically geared towards vaginal use. If it's rectal use, it's going to be a pH of 7. And then their recommendation is an osmolality less than 1200. But I would say, I think an ideal lubricant has an osmolality that's closer to our cells, which is about 300 milliosmoles per kilogram. And then you want to carefully read the ingredients list again and avoid toxic chemicals, which we reviewed several times. So last, I just want to cover coconut oil because I get this question a lot, and then I'll take any other questions that you guys might have before we finish up. So I get a lot, is coconut oil a safe lubricant? It's all natural. You'd think it would be, right? So specifically, the World Health Organization advises against coconut oil and other household products to be used internally as a lubricant. It's an oil, so by definition, it doesn't have an osmolality or a pH by definition. So that term only applies to solutions that are based in water. Coconut oil, though, does have some benefits, and I think it does have a role for some things, some applications. So it's composed of many free fatty acids, including 50% lauric acid, which displays antimicrobial activity. So it could disrupt, theoretically, throwing off that healthy vaginal flora. It also has antifungal properties, though, so it's going to kill off fungus and help control Candida, which can cause yeast infections. Topical applications of coconut oil have been found effective in promoting wound healing through faster epithelialization and help retain moisture when applied to vaginal tissues externally. So I have patients that use coconut oil. I recommend like an extra virgin organic coconut oil if they're applying that externally to the vulvar tissues. It can help with moisture. It can help with reducing irritation, but really isn't meant to be used internally and can create some secondary problems. So I think it has to be used on a case-by-case basis and really shouldn't be used as like a sexual lubricant for penetration. It's also important to note that it's not compatible with latex condoms. So it's an oil-based lubricant, and those are not recommended with condoms. So a question we had were, are all lubricants safe with condoms? So again, based on what I just stated regarding coconut oil, any oil-based lubricant is typically not safe with latex condoms because it can lead to breakage and slippage. There are certain types of oils, the silicone oils, that are commonly applied to condoms during manufacture and have minimal effects on the properties of latex. Also, other types of lubricant are typically safe for condoms, such as water-based and the glycerol-based, although we went into a long discussion of why the glycerol-based can create secondary problems. Another question we have are lubricants safe when trying to get pregnant? So again, that depends. You have to really research the lubricant and determine whether or not it's conducive to conception. So reading that ingredients list, and obviously avoiding the nonoxynol 9, which is spermicide, would be obviously not conducive to pregnancy, but also looking into some of the other ingredients that are there to make a determination whether or not that lubricant is conducive to trying to conceive. Looks like we have the last question, another question. So are household products such as baby oil or body lotion safe to use as lubricants? Can I use body lotion? So again, I have the list here. The World Health Organization advises against lotions, oils. Again, there's a lot of preservatives specifically in those products. So things like baby oil, dairy, butter, they list palm and coconut oil, cooking oil, body lotions, Vaseline are all listed as things you should really try to avoid as a personal lubricant. So it's been a pleasure to get to present to you guys today. I appreciate your time, and let me know if there's any other further questions that I can help with, and we're going to make sure that we link all of the references to this video so you guys can access them if you need to reference them. Thanks so much. Have a good day.